Lately on this channel, I have been talking about some of the more complex topics around cholesterol, like non-HDL, apolipoprotein, lipoprotein A, and other advanced lipid testing. But I have noticed that I've been getting some questions about the basics. I also have been getting some concerning comments in some of my videos that really show how little some people really understand cholesterol. People say things like, cholesterol doesn't matter. When I read things like that, I'm like, whoa. I think this stems from some more recent research showing that dietary cholesterol does not affect the cholesterol circulating in our blood as much as we once thought that it did. But this does not mean that the amount and type of cholesterol circulating in our bodies is not important, nor does it mean that it is not affected by diet. Yes, other factors are important too, but cholesterol still matters a lot. So in this video, I'm going to go back to the basics about cholesterol. If you want to know more about what cholesterol actually is, what your lab numbers really mean, and how to take control of your levels, then this video is for you. Understanding cholesterol is one of the most powerful ways you can protect your heart. After all, heart disease is still the leading cause of death worldwide. And when you know how cholesterol works and what influences it, you are more empowered to make choices that support your heart and your long-term health. Hi, I'm Valerie, a wellness nurse. I believe with the right knowledge and tools, anyone can live a longer, healthier life. In this video, I will be talking about what cholesterol is, why it does indeed matter, how it is measured, and what you can do to optimize your levels and reduce your risk of heart disease. So if you're just starting your journey or if you're trying to manage a few risk factors, understanding these fundamentals is a great place to start. And because I get this question so very often, I'll also be explaining when medications, like statins for instance, might be necessary and how they work as a comprehensive heart health plan. Cholesterol has a bad reputation, but the truth is we actually need it to survive. It's a waxy, fat-like substance found in every cell of our bodies, and it plays essential roles in making hormones, vitamin D, and bile acids that help digest fats. Without cholesterol, your body would not be able to function properly. Your liver produces most of the cholesterol that your body needs. This is called endogenous cholesterol. You also get some cholesterol from the foods you eat, especially from animal-based products like eggs, meat, and dairy. This is known as dietary cholesterol. But many people don't realize that for most people, the cholesterol that they eat does not have a huge impact on blood cholesterol levels. In fact, your body adjusts its own cholesterol production depending on how much you eat. The bigger dietary concern is not really cholesterol itself, but rather the other types of fats that you are eating. Saturated and trans fats, which are found in foods like fatty cuts of meat, full-fat dairy, baked goods, and fried foods, have a much bigger influence on raising your LDL, or bad cholesterol levels, than dietary cholesterol does alone. So I'm going to put up an image now of a nutrition label so that you can see what I'm talking about and see where each of these can be found on food labels. So even though we now understand that you don't have to completely avoid high cholesterol foods like eggs or shrimp, it is important to understand that many foods high in cholesterol, such as those fatty cuts of meat or butter or full-fat dairy, they are also high in saturated fat. And it is that saturated fat that does tend to raise LDL cholesterol levels the most. That's why the focus isn't just on cholesterol itself, but on the overall quality of your diet. Choosing more plant-based foods, healthy fats like olive oil and avocados, and nutrient-rich whole foods can improve the amount and type of cholesterol circulating in your blood. Too much cholesterol circulating in your bloodstream, and especially the wrong kinds, can become a problem over time. Over time, it can lead up to the buildup of fatty deposits in your arteries called plaque. This process, called atherosclerosis, narrows the arteries and restricts blood flow, increasing your risk of heart disease, heart attacks, and stroke. So while cholesterol itself is not the enemy, keeping your levels in a healthy range is critical for protecting your heart and your long-term health. When your doctor orders a cholesterol test, often called a lipid panel, you are going to see several numbers. And I know it can be confusing, but understanding what each of these numbers means can help you know what's going on inside of your body and where you might need to make some changes. So let's start with LDL, or low density lipoprotein. This is what most people refer to as bad cholesterol. And while LDL actually serves an important function, delivering cholesterol to cells that need it, too much of it can create a problem. Under certain circumstances, excess LDL can deposit cholesterol onto the walls of your arteries, leading to plaque buildup. Think of LDL as like a delivery truck that sometimes dumps its cargo in the wrong place. And this can clog up traffic in your arteries. When too much of that cholesterol accumulates, it narrows the arteries and increases your risk of heart attack and stroke. Now, HDL, or high density lipoprotein, is your good cholesterol. Its job is to go around and pick up excess cholesterol from your bloodstream and bring it back to your liver for processing. It is kind of like the cleanup crew, removing leftovers before they can cause problems. Higher HDL levels are generally linked to lower risk of heart disease. So we want HDL to be high and LDL to be low. You might also see VLDL, or very low density lipoprotein, on your lab report. This one mostly carries triglycerides, which are a type of fat your body uses for energy. But when you have too much VLDL or too many triglycerides, that can also lead to plaque buildup over time. It's like a delivery truck overloaded with fat, which eventually becomes more LDL. Those triglycerides themselves are another number to pay attention to. They are not cholesterol, but rather fats in your blood that store unused calories. And when you eat a lot of sugar or processed carbs or drink excess alcohol, triglyceride levels rise. High triglycerides often show up alongside other risk factors like high LDL or low HDL, which makes them a concern for heart disease. I have a whole other video on triglycerides, so look for that on my channel. If you want some help finding it, please just ask in the comments below this video. And there is one more particle that I want to mention, lipoprotein A. Lipoprotein A is a bit different. It's a variation of LDL with an extra protein attached, and it's largely determined by your genetics. If your lipoprotein A level is high, that's something that you inherited, and it's not something that you can change through diet or lifestyle. But it is still important to know because high lipoprotein A is an independent risk factor for heart disease and stroke, even if your other cholesterol numbers are normal. You won't find this on a standard lipid panel. So if you have a history of early heart disease or high cholesterol, it is worth asking your doctor to test for it. I have a high lipoprotein A, so it is a big concern of mine, and I have several videos on it. So just ask in the comments if you want help finding those. All of these values together help provide insight into your cardiovascular risk. But it's important to remember that cardiovascular risk is about more than just cholesterol. Things like blood pressure, inflammation, blood sugar, family history, and lifestyle habits also play a big role in heart health. But cholesterol is a very important piece of the puzzle. So coming up, I'm going to be talking about what those numbers actually mean, what is considered healthy, what might need attention, and how to use that information to take proactive steps for your heart health. When it comes to cholesterol numbers, it is not just about whether your total cholesterol is high or low. It is about how all the pieces fit together. So let's break that down. Now, first, because people love to call me out on this, I want to explain that in the United States, cholesterol levels are typically measured in milligrams per deciliter. But in many other parts of the world, you will see measurements reported in millimoles per liter. So moving forward in this video, I will be using US units, but I will show both values on the screen so you can follow along no matter where you are watching from. So total cholesterol is often the first number people hear, and ideally, we want that number to be under 200 milligrams per deciliter. But a high total cholesterol is not automatically bad. It depends on whether it is driven by high LDL or high HDL. That is why looking at the breakdown is so important. For LDL, which is the bad type that can build up in your arteries and increases heart disease risk, under 100 is considered optimal. If your LDL is between 100 and 129, that might be acceptable if you are otherwise healthy. But anything over 130 starts to raise concern. LDL over 160 is considered high, and above 190 is very high, often suggesting a genetic cause, which usually requires medication. HDL, the helpful cholesterol that clears out excess cholesterol from your blood, is better when it is higher. For women, we like to see it at 50 or above, and for men, 40 or above. An HDL of 60 or more is actually considered protective. Triglycerides, which are a type of fat in your blood, should be under 150. If your triglycerides are creeping above that, or worse, if they are over 200, that is something to work on, especially if your HDL is low or your LDL is high. High triglycerides are often linked to diet, alcohol, insulin resistance, or excess weight. Sometimes your doctor will also look at something called non-HDL cholesterol, which is your total cholesterol minus HDL. This gives a good picture of all the bad particles combined. It is especially helpful when triglycerides are high. I have a whole video on non-HDL cholesterol, so if you're interested in learning more on that, please just ask in the comments below and I'll give you a link. Now, these numbers are not one size fits all. For people who have already had a heart attack, or if they have had a stroke or have diabetes, your doctor might aim for even lower LDL levels, sometimes under 70, to reduce your risk of future events. And in cases of very high risk or genetic conditions, targets can be even more aggressive. Understanding these ranges helps you have more informed conversations with your healthcare provider. You can start to track your progress, ask the right questions, and be more engaged in decisions about your care. Family history can play a major role in cholesterol levels. You might eat a fairly healthy diet, be active, and still have high cholesterol. That is because your liver, which makes most of your cholesterol, is partially programmed by your DNA. And some people have genes that make their liver produce too much cholesterol or struggle to clear it from the bloodstream. A well-known genetic condition is familial hypercholesterolemia, or FH. About 1 in 250 people have it, and many don't know it. In FH, there's a gene mutation that makes it harder for the body to remove LDL from the blood. So LDL levels can climb very high, even in people who are eating healthy. FH often runs in families and is linked to early heart disease, sometimes even in people under age 50. If a parent or a sibling had a heart attack at a young age, or your LDL is very high despite good habits, this is something to talk about with your doctor. Another genetic factor is lipoprotein A, which I explained a little bit about earlier. It is mostly inherited and doesn't change much throughout your life. It is usually not included in a standard cholesterol test. You need a special lab test for it. And again, I have several videos on this, so if you are interested in learning more, just ask in the comments. If your lipoprotein A is high, it raises your risk for heart attacks and strokes, even if your LDL and other numbers are normal. The unfortunate thing about lipoprotein A is that lifestyle changes don't lower it, but knowing your level can help your doctor decide how aggressively to treat your other risk factors. And then there is just general hereditary. Even if you don't have a specific condition like FH or high lipoprotein A, your family history still matters. Some people naturally have higher cholesterol or are more sensitive to dietary fat. If your parents, brothers, or sisters have high cholesterol or developed heart disease early, you could be at higher risk too. So the bottom line is you cannot change your genes, but you can absolutely change your lifestyle. And in many cases, medications can help bridge the gap when lifestyle changes are not enough. Knowing your family history gives you a head start. It allows you and your doctor to create a more tailored plan. This can mean more frequent screenings, earlier interventions, or more aggressive targets for cholesterol levels. Even though your genes can play a role in cholesterol, they don't tell the whole story. In fact, lifestyle factors are often what tip the scale between healthy cholesterol and a number that puts you at risk. What you eat, how you move, how much you weigh, whether you smoke, and even how much alcohol you drink. All of these influence your cholesterol profile. So let's start with diet. The biggest dietary drivers of high LDL cholesterol are saturated fats and trans fats. Saturated fats are found in things like fatty cuts of meat, butter, cheese, and certain oils like coconut and palm oil. Trans fats, which are now mostly banned in many places, used to be common in processed baked goods and fried foods made with hydrogenated oils. Diets that are high in these fats can push LDL up and make arteries more vulnerable to plaque buildup. Eating too many refined carbohydrates like white bread, pastries, or sugary drinks can also be a problem. These foods can lower your HDL cholesterol and raise triglycerides. On the other hand, diets rich in fiber from vegetables, fruits, whole grains, and legumes can help reduce LDL and support overall cholesterol balance. And healthy fats like those from nuts, seeds, olive oil, and avocados can help improve your lipid profile when they replace saturated fats. So work on filling your plate with colorful vegetables, fruits, whole grains, legumes, nuts, and seeds. Choose healthy fats like olive oil, avocado, and fatty fish like salmon or sardines, which are rich in omega-3s that help lower triglycerides and reduce inflammation. Try replacing red or processed meats with lean proteins like poultry, tofu, or beans, and swap out refined carbs like white bread or pasta for fiber-rich options like oats, brown rice, or quinoa. Soluble fiber found in foods like beans, apples, and flax seeds can help reduce LDL cholesterol by blocking its absorption in the gut. Be mindful of added sugars, which can raise triglycerides and lower HDL. And while foods like eggs and shrimp are high in cholesterol, they don't affect blood cholesterol as much as we once thought. For most people, they can be enjoyed in moderation. The bigger concern is saturated fat, which often accompanies high cholesterol foods like fatty meats and full-fat dairy. These are more likely to raise your LDL levels, so aim to limit them and focus on heart-healthy fat sources instead. The general goal should be less than 15 grams of saturated fat daily. Body weight matters too. Excess weight, especially around the belly, can increase LDL and triglycerides while lowering HDL. Even losing just 5 to 10% of your body weight can lead to noticeable improvements in cholesterol numbers. And then there's physical activity. Regular movement, especially aerobic exercise like brisk walking, cycling, or swimming, helps raise HDL and lower LDL and triglycerides. Strength training a few times a week also helps. Exercise tells your body to manage cholesterol more efficiently, and it improves your overall cardiovascular fitness at the same time. Smoking is another major factor. Cigarette smoke damages your blood vessels and lowers HDL cholesterol, making it easier for plaque to build up. The good news is that quitting smoking can improve HDL levels and reduce your heart disease risk dramatically, even within just 1 year. And also alcohol. Drinking excessive alcohol can raise triglycerides and increase your risk of heart problems. So it is a good idea to cut back to just occasionally. All of these lifestyle changes, when practiced consistently, can significantly reduce your cardiovascular risk. They work together to support healthier cholesterol numbers and a healthier heart overall. Lastly, don't skip your checkups. Most adults should have their cholesterol checked every 4 to 6 years, or more often if you have other risk factors. Use those results as a tool, not a judgment. They give you information and power to take charge of your health. For many people, lifestyle changes alone can go a long way towards improving cholesterol levels and lowering cardiovascular risk. But in some cases, even the best diet and exercise plan may not be enough, especially when genetics play a role. If your LDL cholesterol is very high, so typically above 190, that is often a sign of a genetic condition like familial hypercholesterolemia. In that case, your doctor may recommend starting medication right away. The same might be true if you have already had a heart attack or a stroke, or if you have evidence of plaque buildup in your arteries already. In those scenarios, medication is usually considered essential for preventing future events. Another situation where cholesterol-lowering medication might be recommended is if you have diabetes. People with diabetes are at a higher risk of heart disease, and if your LDL is above 70, your doctor might want to bring it down further to protect your heart. Finally, some people who have not had a heart event but are found to be at elevated risk based on a calculation of age, blood pressure, cholesterol levels, and lifestyle might benefit from medication as a preventative tool. Statins are the most commonly prescribed cholesterol-lowering drugs. They work by reducing the amount of cholesterol your liver produces and by helping your body clear more LDL from your bloodstream. Statins have now been studied extensively and are known to reduce the risk of heart attacks and strokes, especially in people with existing cardiovascular disease or other high risks. Other medications might be added in certain cases, especially if LDL levels remain high, despite statin use, or if someone does not tolerate statins. If you do need medication, it is important to remember that it is not a failure. It is a tool. Think of it as part of your toolbox for heart health, alongside your lifestyle efforts. Medication can help lower your numbers, but healthy habits are still essential for long-term success and for managing other risk factors like blood pressure, blood sugar, and inflammation. And if you do ever start a new medication, make sure you talk to your provider about any potential side effects, and don't hesitate to speak up if something does not feel right. There are often alternatives or adjustments that can help you find what works best for your body. Understanding cholesterol is a powerful first step toward protecting your heart and overall health. The more you know, the more confident you can be in making choices that support your well-being, whether that means fine-tuning your diet, staying consistent with movement, or having an informed conversation with your doctor about medication. If you found this video helpful, please give it a like and subscribe to my channel so you don't miss future videos. I'll be continuing to explore cholesterol, heart health, and all the ways that you can take charge of your health, one step at a time. And if you are looking for personalized support, I do offer one-on-one wellness consultations. So whether you're working on your numbers or your nutrition, or if you just want to feel better in your body, I am here to guide you. You'll find a link to learn more in the video description. Thank you so much for watching, and as always, please take good care of yourself.